Hi, today we will see how to give the ENM level and how to give the modifier and infusion injection coding in this particular chart. Yesterday we have seen how to give the ICDs. So today we will see how to give the ENM level first. See, here chief complaint is nausea, vomiting. In HPI, patient is coming with nausea, vomiting. First we will calculate the HPI elements. First thing we need to give, we have chief complaint now and we need to calculate the HPI elements. So nausea, vomiting is a complaint and it is severely from 2 to 3 times. So that will be the severity. Next, when this has happened from morning, so that will be the duration. So severity, duration, and along with that patient is also having the headache, so that will be the associated sign and symptoms. So in order to control that, patient has taken the anti-medication and anti-emetic medication, so that will be the modifying factors. So overall severity, duration, associated and modifying factors. So 4 elements I have got and chief complaint. Now we will go to the ENM table. See, this is the ENM table. So I got chief complaint, HPI, how many elements I got, severity, duration, modifying and associated 4. So 4 means it is extended. Okay, so in this table I got CC, HPI elements as extended, and we will see ROS. What is ROS? So in this ROS, how many things are done? I mean, what patient has told, here we can see. One is constitutional, HENT, respiratory, gastrointestinal, genital, muscular, neuro. 7 things are reviewed by the, it is explained by the patient. So 7 systems are reviewed in the ROS. So 7 means what will be my type of the ROS according to the ENM table. ROS 7 systems are there, so we can calculate here extended 2 to 7. It falls under extended. 7 systems are reviewed, right? So we have 3 types. So my type of ROS is extended, so here it is extended. Next we will see PFSH. How many PFSH is there in the chart? Only one, that is hypertension from the past medical history. In the personal history, family history, social history, nothing is there. So my PMH will be pertinent, because, and we need to take from the new patient, because emergency in anything will be new patient only. So pertinent PFSH. See, because one element is there from the here, as per the pertinent, we need at least one element from any of the, either from one or any 2 history areas. So we have one element from one area, that is past illness from the PMH. So we have that one, that is hypertension from the PFSH. So pertinent PFSH. So all these 4 things are met under what type of history? Detail. I have CC, I have extended HPI, we got 4 elements. I have 7 systems in the ROS, I have 1 element, so that will be pertinent. So according to this, my type of history will be detail. Okay, we'll keep this aside. Detail history I got. So now we will see physical examination. So what is my physical examination in this chart? What physician has reviewed how many systems? 1 2 3 4 5 6 7 systems are reviewed. So we will go to ENM table. So 7 systems are reviewed. So what is my physical examination? This is physical part, physical examination part. Okay, so according to this, what type of examination I will get, we will see. See, in problem focused 1 to 5. So EPF at least 6, here also at least 6, here 9 or more. So 9 means I cannot calculate from the comprehensive. So here we can take, because we have 7 systems in the report, and in detail and EPF detail we have both 6. So as I got detail history, so I am considering this one also as a detail. Okay, so as I have 7 systems, so we cannot take 9 and we can take the lesser one, that is 6 organ system. So my physical examination will be detailed. So detailed history I got, detailed physical examination I got. Next we will see medical decision making part from this table. So what workup the physician has done in this: as patient has nausea, vomiting, so he gave additives, that is Zofran, and he gave the IV fluids. So workup is this one, right? Zofran and normal saline. So we will see in this table, we can see IV fluids anywhere in this. Yes, here it is. This is IV fluids without additives, but here we have additives, that is Zofran, and we have NaCl. So according to this, my medical decision making is moderate. So medical decision making is moderate complexity. So I got moderate medical decision making, physical examination as detailed, and HPI as detailed. So we will see in this, so where the 3 things are there, we can see here. This is problem focus, this is expanded problem, this is EPF. Yes, here it is. Detailed history I got, detailed examination I got, and medical decision making of moderate. So my ENM level will be 99284. So I am giving the ENM level as 99284. 99284. Next we will see any other. Yes, we have here IV infusion coding. So we will see what CPTs we will get. We will see, already I explained in infusion injection coding this one. So now we will apply this here, the CPT coding of infusion injection. So Zofran is given, route is IV, and we need to check the timing as per the guideline. So here only one time is there, only one time means that will be IV push only. So what is my IV push code as per the this one? See here it is. So as per this is infusion intravenous coding. So this is IV push, next is this one, hydration. So according to this, it is IV push, only one time is there. So my CPT will be 96374. okay, so now I am adding that here. So 96374. So next one we will see NaCl. So physician has given sodium chloride, right? NaCl IV route, and we have the timing also, hydration coding this is. So 6 to 7 and 7 to 8 o'clock. So as per the guideline of infusion injection coding, which I explained in the infusion injection, see here, when the initial service is done and second service is also done, we should not give the initial code of the second service, we need to give the add-on code. See here, which I explained in the previous session of the infusion injection. See, so now physician has done IV push, and along with that hydration is also there. So immediately we should not give the initial code, we need to give the add-on code. So that is 96361. So I am giving that code 96361. This is for the initial timing of the NaCl, that is 6 to 7, and again we have one more timing also, right? So as per the timing of this, for each additional hour this code is there. So one more hour also hydration is there. So I am giving one more 96361 code. Okay, so 96361, and instead of adding another one, we can keep like this, into 2. That means the service is done twice. It indicates that the service is done twice. And one more thing, so with this we have completed the infusion. One is IV push, one is hydration. So push code 96374, initial one. So along with that we have hydration also. So I am not giving the initial code of the second service, so I am giving the add-on code, and it is done for 2 hours. So my code is 96361. So coming to the modifier, so Physician has done the workup, that is he gave the IV fluids. So we need to give that physician has done the extra E&M service. So in order to that we are giving the modifier 25. Okay, E&M code is 99284 and C modifier is 25 and the workup done coding is 96374, 96361 twice. So ICDs are done and CPTs are also done. So this completes the chart. Thank you for watching the video. If you have any queries, please comment below.